with you. And we are very happy to have a great speaker for this afternoon. I will introduce Dr. Burns in just a moment. But before, I'll remind everyone to mute yourselves, please, and to use the closed captioning as necessary. There's a button at the bottom of your screen that says CC if you need it. We are recording, so this will be available on our website as soon as possible after we're finished. And so with that, thank you, Dr. Burns, for sharing your screen. Dr. Jeff Burns is our speaker for the day, and he's going to talk with us about the ADRC's Brain Health Initiative. And as always, Dr. Burns brings us useful, innovative, helpful information. A little bit about Dr. Burns. He is the Edward H. Hashinger Professor of Medicine at KU and the co-director, of course, of the KU ADRC, which is one of just 33 in the entire country. So we are super, super lucky to be in the backyard here. Dr. Burns is the director of the Department of Neurology's Neurocognitive Division and the Clinical and Translational Science Unit, and the ADRC's Clinical Core, which is a part of a national clinical trial network. So all the research that we're doing is situated in a really meaningful spot. Dr. Burns started his Alzheimer's clinical research at KU Medical Center in 2004. So happy 20th anniversary, Dr. Burns. Wow. And he's got a Bachelor of Arts in English and Japanese from the University of Notre Dame. He got his medical degree from KU Medical Center, a neurology residency at the University of Virginia, and his postdoc at Washington University in St. Louis. And we are, of course, very grateful that Dr. Burns returned to his hometown of Kansas City to start the Alzheimer's clinical program here at KU. So welcome, Dr. Burns, and also a special hello to our friend Patty Garney. Glad to see you here with us, Patty. And we will look forward to having you speak another time about One Day, One KU. And as we begin with Dr. Burns, I hope we will all keep in our hearts everyone who was affected by the events of yesterday. We sure hope that we can find some peace. Okay, Dr. Burns, all yours. Thank you.
Great. Thank you, Kelly. And yes, thoughts and prayers to everybody affected by yesterday's events. I was down there with my family. And we were in that area earlier. It's just really hits home. It was such a perfect day up until then. And now this is all we're going to remember. So pretty sad for all the families and people affected. And it also impacts our One Day, One KU, which had to be postponed because of yesterday's events. That's a big, if you don't know about that, it's a day of fundraising and sort of awareness, spreading awareness about our program and all of KU's various programs. And it's been a huge day for us over the years, thanks in large part to Patty Garney. So hi, Patty, and sorry about having to postpone. Patty puts in all kinds of work on our behalf, raising money and for One Day, One KU. So it's really sad that we're postponing that, but we'll do it, and that work does pay off, and it will pay off. So so moving on. So I wanted to take a few minutes I think I've done this before, but maybe I see we got a good turnout, and some of this will be new to many of you, but I'd like to give kind of an update on where we are with the Brain Health Initiative. And this is a vision that we've been building for really almost the last 5 years. And yes, I've been here 20 years now in July, not quite 20, which to me is amazing that it's been 20 years already. And we've come a long way. It's pretty exciting that we've come all the way to where we now have a new vision and what we call the Brain Health Initiative. And this is all about thinking beyond where we are today to what we need to do for tomorrow. And it is all about integrating and pulling together, building upon our strengths and our successes, and integrating and moving forward and setting Kansas City and the region and the state of Kansas up for a whole new era of brain health. And so just in a nutshell, let me give you just kind of a big picture overview of what this initiative and this vision is all about. It's really about moving from disease to prevention, from disease to health. moving beyond disease management to a new era where we're thinking about proactive and personalized prevention. So new approaches to prevention and brain health. And we need to pull together everything we're doing and create a new innovation ecosystem that brings it all together to really set us up for a new era of brain health. And that means bringing together and integrating medical science and clinical care better. And it includes a broader vision too. It's not just about Alzheimer's. As I'll talk about, Alzheimer's is a lot of different things. And we're beginning to understand that. And if we're going to cure when, and actually it's not a question of if, it's when we cure Alzheimer's, when we prevent Alzheimer's, it will be because we have a broad approach that goes after many different things. So, so this vision requires a broader scope and greater integration of the various things we're doing. So let me hopefully show you that story a little bit more. So first of all, why is this so important? Well, it's because the brain is so important. The brain is what makes us, what makes you, you. It's everything, everything about you and your personality and your memories and your ambition and your, thoughts, etc. And we all know that, but brain's very different than every other organ. And we all know this. We can't replace it. We can transplant a kidney or even a heart. We can't do that with the brain. So we have to work hard to maintain or to attain and maintain optimal neurologic function across the lifespan. And that's what we have been working on for the last 20 years is this idea of prevention and this idea of moving from disease to health. And so what is brain health? Well, one thing it is it is a national movement. It is a trend that you'll see everywhere, and you're going to see it every day a little bit more. And it's what we've been working on for 2 decades. But this just came out just a few months ago. The American Academy of Neurology put together a big consortium and spent probably about 2 years bringing together a bunch of different stakeholders to arrive at this definition of brain health, which is a continuous state of attaining and maintaining optimal neurologic function. That's basically it. It's how do we do that? How do we help people attain and maintain optimal neurologic function across the lifespan? Now, our biggest focus is with aging, but we know late life cognitive health has a relationship with early life cognitive health and with exercise and diet across the lifespan. And so we need to be thinking about it as a lifelong issue and a lifelong effort to attain and maintain brain health. So it is a new day in terms of how we think about brain health and dementia. We now know that prevention works. We know that on the left here, we have a time window or a window of opportunity where we know changes like Alzheimer's disease that relate to Alzheimer's disease, for instance, began probably 20 years before the onset of memory symptoms. Before we see memory decline, we know 10 to 20 years before that, we see the changes of Alzheimer's in the brain, and that's a big deal. That's a window of opportunity for us to act upon. And we know if we do something about it, that has the effect of postponing the memory changes, that can have a big impact. If we can, across the population, delay the onset of Alzheimer's disease by 5 years, we can cut the incidence in half. And so things like lifestyle, things like diet and exercise, which aren't ever going to be a cure, but they are something that can impact brain health. They are something that we believe can push the onset back for an individual. If someone's destined to get Alzheimer's, and we don't yet know how to identify those people, but we were working on it in a lot of different ways. And we will someday be able to assign risk for somebody. But if somebody is destined for Alzheimer's and we're able to push that onset date back in time, that has a big impact across the population. So small changes can have a big impact. So we need to take advantage of this more and more every day. The other important thing to think about is that brain health, and I mentioned this, it's broader than dementia and it's broader than Alzheimer's disease. We know dementia is caused by many different things, not just the changes that we associate with Alzheimer's disease. We know head injury, we know Parkinson's disease, we know vascular changes like stroke are common and far more common with Alzheimer's disease than without, for instance. When we see Alzheimer's changes, we more often than not see other changes like Parkinson's and stroke. Other things like metabolic changes in the brain, even multiple sclerosis and blood vessel changes, amyloid angiopathy. These are things that are influencing and are part of this process of dementia or memory and thinking changes with age. So we need to move from the simple categorization of, Alzheimer's disease as a clean entity to one where we're thinking in a more precise way, in a way that brings in these other pathologies, these other changes that occur when we see Alzheimer's, and to cure it. So that is essential. When we cure it, it's going to be because we are tackling not just the Alzheimer's changes, but the other changes that we so commonly see in dementia. So now the hope for me is I've seen, now that I'm 20 years in, I've seen a huge increase in the diversity of approaches that we're taking to try to cure Alzheimer's. Every dot on the right, this picture on the right, figure on the right, is a big clinical trial that's ongoing right now. There's a lot of dots there. There's a lot of different colors there, and those different colors represent different approaches going after Alzheimer's disease. So there's over 180 clinical trials underway right now, and there's more than 10 unique pathways that are being attacked or targets or mechanisms, we call them, that may lead to Alzheimer's disease. We need to attack it from all these different angles to cure it. 10 years ago, there were only 1 or 2 different targets. Now there's 10 or more. That is, for me, is a very, very hopeful thing. More treatments are coming, and it is a whole new day. So a whole new day requires a new approach, and we need to shift to a new approach. And that's what our brain health initiative is all about. We need to accelerate what we're doing and where we're seeing success. So for instance, our research in metabolism needs to be accelerated. How do we do that? Well, we need more scientists. We actually have the ideas. We need more scientists to carry them out. We have new treatments, and we have prevention strategies. We need to get those to the people who need them and want them. So we need to scale up our abilities so that we're not just doing it at the level we're doing it at now, but we're doing it at a level that creates access for everyone who needs it. That requires us tripling or quadrupling what we can do right now. That requires more space. That requires more people, trained individuals as well. So we need more training programs. We need to move more towards the personalized solutions to understanding what an individual, what kind of changes are happening in the brain, and make sure we're going after the right things. That is what is happening. That's what will happen, in the years to come. Is the more and more we know about an individual will dictate the different types of approaches we use to help that individual. And then we need to get better at understanding risk. We need to understand who is destined for Alzheimer's disease and when that risk is going to play out, and be proactive about going after that risk and reducing it through interventions and drugs. So I may come back to that in a second, that idea, but we're in a great position to do this. At KU, we've grown from 5 neurologists not that long. I can't remember. Is it 10 years ago? No, 15 years ago. I think there were 5 neurologists. No, it was 2004 when I got here. There were about 5 neurologists. We have 55 now, soon to be 60. We have programs of excellence in all these different areas and more. So we have growing strength in all these areas, leading strength in all these areas. We need to bring that together. More evidence of, strength in these areas is we've got a lot of high performing areas across the health system that are getting, awards and recognition and things like U.S. News and World Report. Look at our highest ranked one. It's neurology and neurosurgery. So we're pretty proud of that. So we're doing things at a high level, but we're also leading nationally in a lot of areas and internationally in a lot of areas. So Dr. Swerdlow and his metabolism and mitochondria studies are internationally known. And the future of Alzheimer's, we think, is, and the cure, we think will require us understanding Alzheimer's in a different way. And that's what Dr. Swerdlow and team, that's what they are doing. It's really moving the field forward. We're part of projects like the Davos, 4 sites in the United States that are part of the Davos Alzheimer's Collaborative, working to try to get the new treatments to everyone who needs it in a more efficient way, and sort of create an on-ramp, a quicker on-ramp to getting the right patients on those treatments and doing it safely. That's not easy, but we're leading the way in doing that. We've got our prevention programming, LEAP, My Alliance, the movie Why. If you haven't seen it, go to YouTube and search Alzheimer's Disease Research Center and put the movie Why in. It's 35 minutes, and it's a beautiful thing that Michelle Needham's created. So we really are leading in a lot of ways. And the ADRC is the foundation for this vision, but the vision is much broader than that. We need to bring in those other programs like Parkinson's and stroke so that we can integrate. And so the vision is all about that. And it's more than a building. We have designed a building. We need a new space, bigger space that drives the collaboration and the synergy across these different teams. Right now we're fragmented and we're all over. I'm in Fairway. Our memory clinic's in Fairway. Our labs are in Kansas City and Wyandotte County in Kansas City, Kansas, at the main campus. We have people in Lawrence. We're spread all over. So we've got to pull these clinics together and the research programs together to get the synergy that we need to really transform how we think about brain health and how we treat it. And we can do it. What's exciting is KU has announced in October, KU announced a big campaign called the Ever Onward campaign, Ever Onward here. And we are one of 4 major priorities. There's the new cancer center building. There's the new stadium, football stadium, and there's the new brain health building and new era for brain health, and a new building on the Wichita campus. And so we're really excited and proud to be seen as a big priority, one of the biggest priorities for the campus, and that makes it possible for us to do this. So we got a long way to go. There's a lot of dominoes that have to fall. The next step for us is really getting the health system aligned and making some decisions about how big of a program we're going to pull into this program. We would like to pull all of neurology into the building. That may not be feasible, but the goal is to bring all of neurology together and put it in the middle of this building, sort of the heart of this building, and surround that with the research that we need to do. So that's the big thing we're working on now. And then the other is we're beginning to connect with donors to get feedback on this vision and refine it and grow it. So this is part of that, but it's also part of sort of communicating the vision. And we're committed to continuing to grow this vision and refine it, and then communicate it back to folks, to our stakeholders, and to all those who care. So anyway, so thank you for your attention. We do have some time for questions, and I'm going to end on this slide here, that we need your help. The day will come when we can prevent or postpone Alzheimer's, hopefully postpone it indefinitely. You are helping us in that. You can help change the future. It's not a matter of if, it's a matter of when. But the ways you can do it is participate. You can volunteer for studies, show up for these talks, sign up for our My Alliance newsletters, advocate, spread the word, and donate if you can. Everything we do is built has been built on the back of philanthropy. We end up turning that philanthropy into big grants that really sustain the program. But I can't point to a single thing we haven't done without having significant impact from philanthropy at the very start of it. So I'll pause there, and I don't know if there's questions, but please you can type them in the chat or speak up. I do want to say, one thing I didn't bring up in this talk is we do have if you haven't heard, we do have new therapies. We've been working for about 15 years here on various studies that did lead to the new FDA-approved drug lecanemab. You may have heard the news about aducanumab or Aduhelm getting taken off the market recently. That doesn't impact, the other drug, lecanemab. So we are part of this new era of brain health is we have new drugs to treat Alzheimer's disease that we've been hard at work for the last 15 years to get to. It's a big deal. Is it for everyone? No. There's safety issues that we have to think about. They're not that easy to take. You have to give them through blood infusions, give them directly into the blood. But they are here, and there is a big role for them. So it is part of this. That's, I think, the first step in this direction of personalized medicine and really more effectively going after and treating Alzheimer's disease. So it's an exciting time. But if you did hear about the Aduhelm getting taken off the market, the Biogen drug getting taken off the market, it really wasn't a setback. We haven't been using that drug. It basically a business decision on their part to take it off the market because there's probably no room for it on the market because we have a new drug, lecanemab, that's out, been approved for a while now. And when there's a second drug that should be approved within weeks, 4 or 5 weeks from Eli Lilly called donanemab. And so very soon we're going to have 2 brand new drugs that we're using in people in the earliest stages of Alzheimer's. So, okay. So maybe I'll do this. If there's questions, please throw them in the chat or feel free to speak up. If there's a question in the chat, what are the benefits of being diagnosed as to what might be causing the MCI and how and where can I get the diagnosis? Well, I just talked about the new drugs. The new drugs are something that can be used in the MCI stage. What is MCI? Mild cognitive impairment. It is very, very early changes of memory loss or cognitive change that, is probably, we tend to not consider that age-related change, but something that we want to raise a red flag and say, is there something else causing this? What else could cause it? One of the big things is early Alzheimer's, but it's not the only thing. But that's the one big thing that we worry about. There's ways to get to the bottom of that, like doing testing on spinal fluid to see if there's Alzheimer's changes in the brain, or a new fancy test called amyloid PET scans that can tell us if there's amyloid in the brain. If there's amyloid in the brain, the likelihood is the mild cognitive impairment is related to the earliest changes of Alzheimer's disease. Now, that's important, especially important now, not just for the diagnostic reasons, but because these new drugs go after amyloid buildup in the brain. And so if we're going to go after amyloid buildup in the brain, we want to do that early. So I would say if somebody has MCI, they ought to ask their doctor if they're eligible for the new drug. And to answer that question, there's a series of tests that have to be done. And so I would pursue that through your doctor. We're doing it here in the clinic, so you could also come to our memory clinic. But I would specifically ask, am I eligible for the new drug? Because we're creating new ways into our memory clinic that don't take months and months and months, but are quicker, that hopefully will take about a month to get in. So you can look into that. But you may need a referral from your doc. So talk to your doctor or come and try to get a referral to understand if you're eligible for the new drugs. So, okay. So there's a whole lot I could talk about there, but so somebody did really well in a memory test and you're still interested in being part of the study. We need people with and without memory problems. So congrats on doing really well on your test. And if you don't have any memory changes, you could still participate. And Dr. Lewandowski told John to give us a call or come or visit our website. Next question was, how will these new drugs be administered? With MCI, how do we obtain them? Well, you have to get diagnosed. You have to have all the proper safety checks and the proper diagnostic assessments, which really is an amyloid confirmation of amyloid in the brain through an amyloid PET scan or a spinal fluid test, a lumbar puncture. We do an MRI scan to make sure there's no changes that put people at higher risk, like we call them microhemorrhages that can be seen in the brain. We don't want to see those because that puts you at higher risk for too high a risk for the drugs. So we need an MRI. We do something called ApoE gene test, also to understand risk. So that's important to do. And then we do a little bit of cognitive testing to kind of confirm, yes, we can see memory changes. We can observe that confirm that there are some memory changes, but the memory changes aren't too much. If somebody tests very poorly on their tests, say 20 or below on something, and I shouldn't say very poorly because 19 is not that bad, but we want to get people early. And so what we're trying to do is confirm, because the drug doesn't appear to be effective when we get people a little bit later. So we want to get people who are really in the mild stages. So we do a little bit of cognitive testing to demonstrate that that there is clear impairment, but that it's in a mild stage. So those are kind of the steps that have to be done. So talk to your doc about that. Now, when you get the drug is given by vein every 2 weeks, meaning you have to go in, got to get a line placed, and then over an hour, you're given the drug. So it's not as easy as taking a pill. So there is a bit of a lifestyle change, organizing around the idea of having infusions every 2 weeks. The new drug, donanemab, when it comes out in March or April, will be given every month. So a little bit less. But that's important. It's not just a pill. And then actually we have to do MRI scans about 1, 2, 3, 4 the first year that somebody's getting the drug, to look for microhemorrhages and or swelling that can happen from the drug. So please repeat the new drug names. Leqembi or lecanemab, but Leqembi, Leqembi, no U, Leqembi, Leqembi. And then the other one is called donanemab, but it's ELAT. They're going to come up with a fancy name for it, which we don't know it yet, but when it's approved. So the assay, okay, yeah. So I've been talking about how we assess amyloid in the brain. And we do it through a fancy PET scan or spinal fluid testing, or doing a lumbar puncture. Well, the world is going to change. Our world is going to change pretty quickly because we now have blood tests that can give us a whole lot of insight, if not confirm the presence of amyloid in the brain. And we're doing those blood tests on the research side. So Hal asked about thoughts on the assay for plasma p-tau217. What does that mean? That means thoughts on the new blood tests for amyloid in the brain or Alzheimer's tests. We have blood tests now for Alzheimer's, and we're just beginning to use those in the clinic. Really exciting time. We're just starting to use them in the clinic with our patients. We've been using them on the research side for years. So we've got big change. It's a really transformative time for Alzheimer's disease. We've got new diagnostics coming. We have these new drugs. And so putting those two together are really helping us move things forward. So there's a lot there. Good. Thanks, Kelly, for putting the name. Kelly put the name of the drugs in the chat. Okay. Any other questions or thoughts? Okay. Well, bottom line is transformative time, and we are right on the cutting edge. We're leading the country in a lot of different ways. And this brain health initiative that I gave you so hopefully a nice overview of is we think the way to set Kansas City and the region up for the next 20 to 30 years of a new era of brain health. We're excited about this. We think it's important for Kansas City, as important as things like a new stadium downtown, or the Kauffman Center, or winning Super Bowls. Kansas City needs this, and we are in an incredible position to really do it in a big and a new and important way. So thanks for being a part of that. We appreciate it, and it's a community effort. So thank you.
Thank you, Dr. Burns. It's exciting to be part of the winning team with you and everybody at the ADRC. Next Thursday, we will be talking about the DAP, that's DAP fitness program with Joey and Krisha. So if you want to hear about their latest information on exercise and fitness, join us next Thursday, 2 o'clock. That will be February 22nd. The recording from today will be available shortly. And everybody enjoy the rest of your day. Thank you.
Thank you.